Well, good morning, everyone, and welcome. This morning we have our friends here from Total Benefit Solutions. We have Tatiana Schnadenberg, Haley Vachon, and Debbie I, Dylan. Yes. And we are going to be talking about hospitality health insurance today. If you have any questions, go ahead and type them down in the Q&A at the bottom of your screen, and we can answer those live during the presentation. And if you would like to see this later, or if you miss any of it, you can catch it on our website later on today. It should be in the events section. We have a new website, and so it's a little bit harder to find things these days, but hopefully you will get an email with the presentation also. So with that, I'm going to go ahead and hand this over to Logan. Logan, how you doing today?
I'm doing good, Lisa. Yeah, thank you so much for the introduction. As Lisa mentioned, my name is Logan Dozier. I'm our insurance solutions senior manager here at the association, and so excited to talk about this member benefit and really this member-driven program. At the end of the day, the Hospitality Health Insurance Trust is driven by you, the members, and our trustees, who are members as well too. So we always appreciate your feedback, your involvement in either telling your broker to get a quote through us or working with us to get a quote through one of our preferred brokers. Now more than ever, it's important to shop around and see what you can get. And we are so excited to continue to bring this program and this value, whether it be ancillary lines, medical, dental, vision, all that good stuff. But I know my friend Tatiana here is going to talk about all of this and more. So feel free to ask questions as we go along. And with that, Tatiana, I'll let you take it from here.
Thank you. I'm Tatiana, account manager in sales for High. The trust has had a few names amongst our partners and brokers, so you might have heard formerly called High Hit, and now we go by High, HHI, Hit, the High Trust, High. That one's really funny when people say it. HIT was formed in '94 and it was designed exclusively to fit the needs of our hospitality industry. As you know better than anyone, hospitality traditionally has a little bit higher turnover and lower profit margins. Because of this, your employees often don't get to benefit from employer-provided health insurance. The trust allows groups of 2 or more to join into a large group purchasing power and thus access to better rates. With HIT, carriers have lowered the minimum thresholds to only requiring 50% of your eligible employees to participate and allowing the employer to contribute as low as 50% of the employee-only tier. Most carriers require 75% participation and contribution. And then we also allow management and owner carve-outs. So that makes us just a little bit more unique. Just to note that HIT is exclusive to members of the Washington Hospitality Association. So what qualifies as hospitality? It's not just restaurants and hotels. Think bigger, like entertainment, tourism, lodging, eateries within a grocery, or even a human bar within a doggy daycare. Yep, genius, right? We've seen hair salons, golf membership clubs, and lots more. If you can tie your company to hospitality and you're headquartered out of Washington, we can help you. Here's a quick rundown of what HIT offers, and we'll go into more detail on each one. Just a note off the top, all lines of coverage are a la carte, so uncommon enrollment is allowed. You do not have to purchase one line of coverage in order to have access to another. We have 2 medical carriers, Kaiser and Aetna. Emeritus and Willamette offer our dental. We have Emeritus Vision, and then also we've round that out with some EAP, Teladoc, and life and accidental. Here's a quick snapshot of what we offer with Kaiser. I don't expect you to memorize all of this, but I just want to go over a few things. You'll see them highlighted in green. We're adding a $4,000 deductible option this year with just $10 copays. So the copays are good on office visits, urgent care, lab, generic medications, and a lot more. This allows the immediate benefits for the vast majority of claims that come through. There is no coinsurance, so it's more like a catastrophic coverage where inpatient services and outpatient surgery are subject to the full deductible, but preventative care and telehealth are covered in full. At the bottom on the right, you'll see that I've highlighted the Zircon and Z2. These are both $5,000 deductible options at 50% coinsurance. They have the first 4 benefit through Kaiser. This is where the member gets 4 visits a year before deductible and coinsurance apply. The immediate benefits of the doctor visits, lab, and x-ray, as well as the low premiums, are why these are our most popular items. Lastly, on the left, I've highlighted the Virtual Plus. Just something to point out there, the difference between virtual plans with Kaiser and Teladoc, which we'll go over here in a little bit, is that the member's health record flows seamlessly from virtual to an in-person physician in Kaiser's network. The underwriting guidelines for Kaiser are groups with 2 to 9 enrolling can have a dual option, and then 10 or more can have a triple option. As a side note, when our quotes are sent out, we already do the work of figuring out who is eligible for an HMO based on zip codes. So quite often in my comparison email to your broker, I will suggest offering a dual or triple option just to save money. So having an HMO for a low cost and up to 2 PPO plans for the richer benefits. Kaiser has some wellness benefits that aren't super obvious, so I like to point those out. Calm is an app that has some guided meditation if you'd like some help getting started with meditating. Headspace is more of an active role. It has the one-on-one coaching and some self-care activities. Then it's even available through texting. A note on ages, Calm can be used for members age 13 and over, and Headspace has a minimum age of 18. And as long as you start at the Kaiser website, kp.org, you can get these programs for free through Kaiser. Kaiser also has a fitness program called OnePass. This is a subscription-based, starting at like $10 a month, and you can cancel at any time. This includes gym classes and some on-demand routines to do on your own or even join a live event with others. You also get 20% off of chiropractor, acupuncture, and massage when using the OnePass Select. In addition to Kaiser, we also offer Aetna. Aetna's nationwide network makes it an awesome choice for groups that are headquartered in Washington but have locations outside of the state. So we have the same enrollment requirements, 2 or more are needed for a sale. We do the carve-outs with Aetna as well. 2 to 9 enrolling can have a dual option and 10 plus can have a triple. However, please note that we can't offer Kaiser alongside Aetna at the same time, nor can we move an existing group from one carrier to the other at renewal. The highlighted piece right here, the $4,000 option, is our new Aetna plan for 2026. This plan also includes the Flex 5. So Aetna's Flex 5 is a lot like Kaiser's first 4. It offers the enrolled up to 5 in-network services with no out-of-pocket costs, so before your deductible and coinsurance. This includes office visits, urgent cares, walk-ins, labs, and even some x-rays with some locations. There will be 2 plans with the Flex 5 benefit in 2026. A few programs of Aetna's for wellness that we want to highlight is the Strong and Smart program is designed exclusively for the hospitality industry. So these are available through your member website login at no additional cost to you, just like with Kaiser. For the body, Aetna has partnered up with Hinge Health. I've personally used this. I love it. You take a survey and you get custom content sent to you for you to do on your own anytime. For the mind, Aetna has some resources that can help you relax, help you sleep, and even deal with challenging customers, which I know none of us have ever had. Aetna's digital health platform is called My Active Health Wellness, and it has its own app. Members can earn up to $100 in electronic gift cards just by completing simple wellness activities. So you take an assessment online, you connect your activity tracker, and go. In addition to the great medical options we have, we offer a full benefit package with our ancillary partners. With Emeritus, our brokers have had nothing but great things to say about Emeritus, and for good reasons. We have, first of all, I won't go line by line on this slide, but we have a $1,000 maximum ortho that can be added to any plan with children. That is the only wait period with Emeritus Dental, and it is 12 months for new enrollees. For 2026, we have a brand new plan. we kind of sought after a skinny plan to help groups offer more of a basic, low-cost entry level option. The new plan has the same benefit breakdown of our others, but with a lower annual benefit of $750. It also doesn't have the enhancements like rewards and preventative plus, which we'll go over in just a second. And that allows us to offer this super cheap option. And this just helps employers get their foot in the door and able to offer some dental benefits. Preventative Plus is included on all of the other plans except for the new one that I just mentioned. This is where any benefit that's classified as type 1 or preventative does not take away from the annual maximum benefit. That saves the whole maximum for the higher cost procedures where it's really helpful. The other enhanced benefit is dental rewards. With at least one claim per year, like a cleaning, you can carry over any unused benefit dollars as well as earn benefit rewards. So you can have a maximum of $1,000 in dental rewards to apply to future procedures. Our second dental carrier is Willamette. We offer a high and a low plan. The high plan has the lower copays on all services, while the low plan is about 15% savings from the richer plan. I always like to bring up Willamette if you're a group that's looking for adult ortho. Not only does Willamette do ortho, but they offer Invisalign as one of their options. With our vision, we also use Emeritus. It's pretty straightforward. We have 3 different network options: VSP, IMED, and then a no network option, which is a reimbursement-based benefit. For our life insurance, we have 2 different levels. We have a $10,000 and a $25,000. And while we can't offer those at the same time for a group, we can change to a different level at renewal if you'd like. Teledoc, just some metrics for the high group. We have great utilization, and most of our appointments are being scheduled on the app and held via phone. And the average response time between initial request and actually speaking to a doctor is 7 minutes. So that is huge. This is possible when your employees set up their profile beforehand. So I always recommend encouraging them to set that up when they're not sick, so that when the time comes, it's just 7 minutes. Our members have a wide array of utilizations based off of our metrics. Respiratory, urinary tract, ear, nose, and throat, depression, and back pain are just a few things that our members have used Teledoc for. Lastly, employees' dependents are also able to use Teledoc at no extra cost. ComPsych is our employee assistance program. Our metrics show that our members are using it for emotional help like grief, anxiety, and relationship counseling, as well as legal help and financial advice. Something to remember is that each employee and each of their household members get 6 sessions per issue per person per year. So there's no starting on a problem and not getting to see it through and get some clarity. You're going to have 6 sessions to help finish that. Vimly is our third-party administrator. They handle all of the billing and eligibility. They also do all of the COBRA. So all high groups are COBRA eligible, and Vimly takes care of that for us. You can also assign anyone in your group to have access to Vimly, as well as your brokers. Along with your broker, I just want you to have a glimpse into who you're working with behind the scenes. TBS is in the top 100 best companies to work for in Washington for the 8th year in a row. This is an award given by our own people from within. So we like who we work for, and everyone knows that when you like what you do it well. So talk to your broker today. If you've seen anything that you don't currently have that you want some quotes on, we are getting ready to start quoting for 1/1, and we can simply add that to your renewal if you are a member of High, or we can get you some new quotes. Thank you. Any questions?
If anybody has any questions, you could type it in the Q&A at the bottom of your screen.
Tatiana, what should our members expect when going through the quoting process, either with their current broker or with a new broker? What should they prepare to get a quote through HHI and through our other products as well too?
That's a great question. So the two things that we'll need are a census. So that name, zip code, gender, date of birth, employee and dependent if possible. And then we will need your current plan information. And that includes rates, renewal rates, your plan design. And if you don't have a plan, that's perfectly fine too. You just won't send that part in, but we'll need your company information and a census. And you
Gotcha.
can go to either HHI at tbsmga.com or your broker.
Perfect. And then what if my renewal is 6/1/2026 coming up? Can I still get a quote through HHI even though this is the busy selling season right now?
Absolutely. Yep, absolutely. So all groups renew 1/1, whether regardless of the date that you come in. So if you join high on 11/1, you're going to renew 1/1 as well. If you join on 6/1, you're going to renew 1/1. So we can quote at any time regardless of your renewal date.
Perfect. Thank you.
I see cues. All right. Amanda says, we are a large group headquartered in Washington, but doing business in 11 states. Do we qualify for this program? Absolutely. So as long as you're headquartered in Washington, then we could quote for you. I would say Aetna would probably be a great option for you. And looks like Davey's responding. I'll let her finish that up there. All right. Mary asks, you've mentioned 50% of employee enrollment. What if you can't get 50% of employees to enroll, even if 50% are eligible? That's a great question. So that is where some carve out, or if you classing out of your employees will come in handy. If you, let's say you have 50 people and you can only get 15 to want to enroll. Well, maybe 30 or 25 of those 50 can be classed out into a specific carved out, and then you have 15 of 25 enrolling. Does that make sense?
Yeah, so with high, we can do like hourly versus salary management. So a lot of times we can find a certain class that would fit to make it a better fit for that participation. We can also look at valid waivers as well.
Good question. So you mentioned that these plans are part of a larger group. How big is the group in Washington? We have about, I had these numbers, I want to say 3,500 members in high right now. So a very large group. We have about between 300 and 400 groups. If you carve out a group to meet the 50% mark, can you still offer benefits to all eligible employees? Absolutely. Yep, we have all ancillary options that could be offered to them as well.
All right. Should we give everyone a couple of minutes for another question or two?
We also have a website that has all of the plan documents and anything you could want. If your questions weren't answered today and you don't feel like emailing Tatiana, even though you should because she's really fun to work with, we do have a website that is High Hit Trust, and that is a really good place to go if you just want to do some research on your own.
Absolutely. We keep all the applicable summaries and forms and everything on there all year long. The underwriting guide is on there. So,
Looks like we got a couple more questions.
right.
Yeah. Can you explain how the group plan can work with the MEC plan?
Let me see. So we would be able to replace the MEC plan I think that's what you mean, maybe. We could replace the MEC plan and get some ancillary added there for you as well.
And we have another one who's confused. If 50% of the enrollment is required, why are the rates for a minimum of 2?
I think so. If
So
they're
go ahead, Tatiana. You want me to answer it? So if a minimum, we do need a minimum of 2 to enroll in a plan, 2 employees enroll, or like an owner and an employee. However, say you had a 4 life group, so there was 4 employees eligible, we would need a minimum of 2 of the 4.
And then we have, they're a franchisee, but are getting ready to bring on a non-restaurant concept. Can they participate in this plan also?
So something to note is they have to be a member of Washington Hospitality Association. So if they qualify for WHA, they would qualify for the high trust. And also just keep in mind, like I said earlier, keep a broad open mind when we term hospitality. So I know you said it's not non-restaurant, I think it said, but we may be able to tie that to hospitality in a different allied way or something like that.
Yeah, well said, Tatiana. I'll just add on that point too. Even if you are not a current member of the Hospitality Association, you still can get a quote and see the value of the trust. Just know that you have to be an active member once you enter into the trust and any of the products that go along with it.
Yep. And if you start with high, we can help you through the process of getting the quote to become a member through WHA. Very simple. Logan is our heads person for that. So.
Of course.
Well, all right. Once again, we are recording this and we will have this up on our website later on today in the events section. Like I said, it's different from what it was last week, but you will also get it in your email either later on today or first thing tomorrow morning, depending on any number of things. So if you missed any part of this, if you want to go back and listen to something again, you will have access to this. So with that, thank you all so much. This is a very informative webinar today.
Yay. Thank you.
Thank you, Lisa.
Thank you.
You
Bye.
Thank you,
Thank you,
everyone.
guys.
have a great day.
Have a great day. Thank you.